denying you that enjoyment. They're here, so I'll say enjoyment. And then they're also risking your health. They're risking your health because of they already risked. They put yes, they did not risk. They endangered you, and they were successful. Number three, there are women I've read out in research in Kenya that it causes it brings the risks at childbirth because of the birth canal. They interfere with the passage, and most of the time they cause women to go to cesarean section side, and some lose their life. So those three. Now go ahead.
And you know the worst part, my culture is, you know what they tell you? Do you have to sleep with the man 3 consecutive days, no stop? If not, you're gonna get back to zero. And then this culture is like every 3-4 hours they will come and lock the door, tell you go out, because at that moment all they are seeing is you need to be pregnant. So it was a culture. All they were seeing as them, they were enjoying the party, the dancing. They don't care about you as a person. So now me, I am too much connected to everything these people are saying. That's why people think I am strong. That's why I locked my door. The other one, I left her outside. So these are things that every lady, especially us from Africa, we should be, although we should be advocating for health, but these two we should be advocating for. Because still now, whether we know it or not, still now some of our family members are doing it to their kids. They are doing it. And they think it's okay. And they think it's culture. Because they are still living and they are still seeing you do, they did it to you and I'm still living. So they think it's okay. We just say, but it's, you know, because we travel, that's why we are saying. How did I remember all this that happened to me when I was a baby? How did I remember that? It happened to me when I was a baby. How did I remember that? And the worst part, with that pregnancy, with my first child, the pregnancy, right? I did not have good nutrition to eat. I was eating sand or rotten vegetables. These were the kind of foods I was eating. And you see where my anemia started? This was the time my anemia started. I was like 6 grams, 5 grams. So I'm struggling. And this is where my constipation started. And I had this child. I remember I was in labor for like a month. When I go to the hospital, they tell me, oh, it's sometimes you see they tell you it's false labor. Do you hear about that? Yeah. So I was going through that. But I know how much pain I was going through at that moment as a mother, as a woman. So I remember the day she was coming. So since 9 a.m. at the house, that's where the water breaks. Since 9 to 3 p.m. I'm in labor. They couldn't do much for me. So when I remember they told me that, oh, we have to take you to a bigger hospital because you need a surgery. And I was already tired. I could not. I started having eclampsia in pregnancy. I started having eclampsia while I'm in labor. So I told them, right now I just want to die with the child. I don't want to take this anymore. So I think the last thing they asked me was, okay, now we have to tear you like three different. We have to tear you 3 times to open you more to get the baby. I said, I don't have a problem because I'm not seeing down there. But when they did that, they left the gauze inside a whole week. I'm going home. They put me on hot water and Dettol. You know, in Africa, when you have a baby, that gauze was soaking wet inside me. So
Do you understand where now you I did not even know, but you said they tore you.
Yes.
Circumcision.
Yes.
Caused that.
Yes. And then now you can see what that circumcision causes me. So when we do this naming ceremony thing. So when they came, you have to dress up and stuff. Do you know when I was wearing the skirt, I lift my leg to put my skirt in. Here comes the gauze came out of me, and all these strings, everything just was like boom. I started bleeding all over. People are enjoying. I am like this in the middle of summer. Yes.
Fatou, listening to these things that you've gone through, and they still go back to that circumcision. It's really painful to hear this. Now, will you share with us, how did the treatment for cervical cancer go? Now, after the time they've told you there's HPV, they treated you for the HPV, they gave you the medicine to stop the bleeding, and then after that you went for surgery. Is there chemotherapy for cervical cancer?
Yes. So I have to do like I did 7 sessions of chemo. Yes, I did 7 sessions of chemo because my healing for my cervical, it was really, really, really tough for me. So I think with all the the problems back then, now it's affected me so bad. Yes, because it looks like I never healed inside me when I was young. Hi Tuti, how are you? Yes, I've never healed with the circumcision, with the infections, with the pregnancies. So nothing healed inside me while I was in Africa. So now with the cervical cancer, it makes it. So with the cervical cancer, it makes it worse. So how they tell you your body, it needs to heal inside. Mine was not healing inside. So it was even hard for me, to be honest with you, even wearing pants. Sometimes when I wear some pants, it's hard to, like, I have to bring it down because I get scared. And just 6 months getting that emergency surgery for the baby. So it was, things were so much into each other. But I overcome it.
If you're talking about the pants, that means even if it's happening right now, it means you're still experiencing trauma from.
Yeah.
And did you get a chance to talk about this with your therapist also?
Oh yeah, I have a gynecologist. I have a cancer gynecologist. Yes, and I have a therapist. Oh yeah. So
So do you think that counseling helped you also to deal with this during these treatments, breast and this, then cervical cancer? How did the counseling help you through this process?
counseling did a great job for me
Yeah.
because the accept not like I was not accepting, but I didn't know it was the cause.
Yes.
That was my problem. I didn't know this was the cause. But now, sitting down, I'm telling them this, and I'm connecting 1, 2, 3, 4, 5. Now I'm like, okay, it happens. I'm not gonna change anything, all right? But now my problem here is I can make sure this doesn't happen to people that I know, and I'm gonna be standing there for them. Like you said, write a book. Even if I'm not here, that book, they would read it and say, oh, there was a lady, she's a Gambian, and she spoke about this. And why are people, because still now, that's why people are scared to take their kids to Africa. And why are you having that fear? You love the country you came from, but you still having the fear because of this. Because you feel like when you take your child and you are not there, they're gonna do the same thing to the child. Because they see you still living in this life, they think it's okay, nothing is wrong. But I am dying slowly. I am. Whether I said it loud or not, it is.
So when you say you're dying slowly now, I want to take you back to the breast cancer and to the cervical cancer. When you finished treatment for this, and then mark you guys, she was also now having kidney treatment for, is it kidney or liver?
Kidney.
Kidney, right? So
Polycystic kidney disease. Yeah.
now, how did the kidney one come in the mix of this?
And the kidney one was the first thing they noticed.
Oh, the kidney came before breast cancer.
Yes.
I forgot. Yeah.
That's why I told you this pregnancy.
Revealed so many things.
Yes. So I was a high risk of, so you can see, high risk of pregnancy, because all this were standing at the window. But because I was doing good with my health, nothing was showing. Because I was not pregnant, I'm by myself, I'm eating good, I'm sleeping, and now again, I'm married. Here comes pregnancy. And you know how the difference is 11 years. 11 good years.
From the first pregnancy to the second pregnancy?
Yes. 11 years. So that's how long. I was not married because I throw everything behind. Like I don't sit here and be thinking about what me and Candid Diana have to go. No. That I think those are the things that really helps me.
Yes.
With my healing process, because I don't let things sit in me.
Yes. Yes.
So when that happened, I remember I went to work. I worked at the airport.
Yeah.
Do you know my job called me and sit me down, told me, Fatou, I said, HR said, the HR manager, 2 managers, they said we needed a doctor's letter because I love my makeup like you.
Yes.
But so I was not doing none of those. And I was throwing up in their trash can all over. Like, they can see, but I'm not having any pain.
Oh, that is when now they saw it, and that's when you went in and they found the kidney disease?
Yes. So my kidneys I went to the emergency room. That's where they told me that you have a kidney disease. It's called polycystic kidney disease.